Good morning, everyone. So today we're going to discuss the first part of our fluids and electrolytes. So don't worry, it's a very short topic. It's approximately 10 slides for the first part and probably another 10 slides for the second part. Now first, before we tackle into that, I want you to recall the difference between a solute and a solvent. A solute is a substance that is dissolved in a mixture. Okay? Dissolved in a mixture. So, kung kape pa siya, it is the 3-in-1 coffee grounds. Okay? Examples of these are our ions, such as our sodium, potassium, calcium, and every other ion left and else, and our protein, such as our albumin. Albumin. Next is our solvent. Our solvent are substances that are capable of dissolving. So let's say for instance kato sa atong coffee na pud no na analogy, it is our water, di ba? The coffee grounds, which is our solute, will dissolve in our water or our solvent. Now class, aside from that class, I also want you to recall osmosis. Osmosis is the movement or diffusion of water from high solute concentration. Sorry. It is the movement of water towards a high solute concentration. Towards. Okay? So when we say osmosis class, for example, this is our blood vessel. Okay? It is filled with solutes. Okay? Solutes. For example, our albumin or our protein. Okay? Let's say, for example, your water is here. Okay? Since osmosis is the movement of the diffusion of water towards a high solute concentration, that is the reason why water will go into your blood vessels towards your proteins or albumin. As I've said, diba, if you remember, wherever proteins go, water follows. Okay. So class, let's start first by discussing our body fluid compartments. Okay? Our body fluid compartments. Approximately 60% of the total weight of an adult male is consisting of water. Okay? Whereas it is 50% in an adult female. The remaining percentage of weight is the rest of our body. For example, our organs. But the most of the time, most of the weight of our body is tangled in our body fluids. Okay? The water and ions dissolved in it are distributed into two major compartments. Number one is our intracellular fluid compartments. When we say intracellular, it means inside the cell. Whereas when we say extracellular or the other one, it means outside the cell. Water and ions move between these compartments, but their movement is regulated. Most of our regulatory mechanisms will be discussed in chapter 2. Okay? So our intercellular fluid compartment consists of all the fluid inside the cells of the body. This fluid is part of the cytoplasm of the cell. If you remember, our discussion on cells, the cytoplasm is the fluid that surrounds the organelles of the cell, and it has a similar composition in all the cells of the body. Okay? When we say composition, we will talk about that later. The intracellular fluid compartment accounts for the majority of water, or about 70%. So most of your water is found intercellular. Okay, most of about 70%. Okay, whereas our extracellular fluid accounts for around the remaining 30% of all water in the body. Okay, the fluid consists of fluid outside all the cells of the body. Now class, when I tell you class, what do we mean by outside the cells of the body? When we say that class, our extracellular fluids are distributed into multiple subcompartments. When we say subcompartments class, let's say for example, we will visualize it. Let's say for example, this is the percentage of your intercellular fluid. Okay, whereas the remaining 30% is our extracellular fluid. When we say subcompartment class, our extracellular fluid is divided into five, five, five compartments. Okay, and we will discuss those compartments like this. Okay, the first compartment is our interstitial fluid. When we say interstitial fluids, this is the fluid outside the cell found in between the cells. Okay, this is the fluid found outside the cells and between the cells. Next is the plasma of the blood. The plasma of the blood, the lymph within our lymphatic vessels, our cerebrospinal fluid of the brain and spinal cord, outside the brain and outside the spinal cord, and our synovial fluid, the fluid which lubricates our joints, found within our synovial joints. But I want to mention class that most of our ECF fluids are found in our interstitial and our plasma. The remaining three only accounts for a very limited portion of extracellular fluid. Most of our ECF class can be found in the first two. That's why they are the ones that we will tackle on further. Now class, the composition of fluid in the body fluid compartments include what we call our cations and anions. When we say cations class, we are referring to positively charged ions. Whereas when we say anions, we are referring to negatively charged ions. Now class, this chart looks deceiving, okay? But take into consideration that interstitial fluid and plasma are both ECF, okay? Whereas this one is our ICF, okay? Now class, the major cation in the ECF is our sodium and our calcium. As if you can see class, the amount of sodium in the ECF compared to the ICF is much higher and same goes with your calcium. That is why it is the major cation of the ECF. The major cation of the ICF is your potassium and magnesium. See, the potassium is much higher than in your ECF. The potassium in your ICF is much higher than in your ECF, whereas the magnesium is also much higher in your ICF than in your ECF. Okay, that's why it's the major cation in the ICF. Whereas glass, the major anion in your ECF is your chloride and bicarbonates. As I've said, no, there are much more chlorides and bicarbonates in your ECF compared to your ICF, which is a lot lower. So class, the major anion in the ICF is your phosphate and your sulfate, because these are concentrated much higher in your ICF compared to your ECF. Now class, the concentration of proteins, if you can notice class, the concentration of proteins is also much greater inside the cell than outside the cell. Okay? The concentration of proteins is much greater inside the cell than outside the cell. That is the reason why, class, there are more fluids inside the cell than outside the cell. That is the reason why. That is the reason why our intracellular accounts for about 70% of our fluids, because if you remember, wherever protein goes, the fluids will follow. Okay, very nice. Exchange between the body fluid compartments, class. Next, the exchange between the body fluid compartments. The cell membrane separates the body fluid compartments are selectively permeable. Okay, in this instance, class, water is able to pass continually through them, but the ions dissolved in the water do not readily pass the cell membrane. Okay, do not readily pass the cell membrane. Now class, water movement is regulated mainly by hydrostatic pressure and osmotic pressure. Now class, when we say hydrostatic pressure, class, this is the pressure that pushes fluids to movement. Okay, whereas when we say osmotic pressure, class, this is the pressure that pulls fluids towards the source. Okay, this is osmotic pressure, class. If you remember, it is regulated by our albumin. Okay, so that's why, class, wherever water goes, the albumin will pull water towards the albumin. Okay, so let's say, for instance, class, for example, class, okay, in your capillaries, we have an arterial end, and we have our venous end. Okay, if you remember, class, our arteries, our capillaries, diba, they are the meeting points for your arteries and veins. Now class, normally the hydrostatic pressure, or the pressure hydrostatic, is much higher in the arterial end. Okay, the red part is the arterial end, whereas the blue part is the venous end. And osmotic pressure, in turn, is much lower because of the high hydrostatic pressure. Okay, osmotic pressure is in turn much lower because of the high hydrostatic pressure. Now class, that is for inside the vein. Okay, inside the, not the vein, the blood vessel. So susulod na siya sa blood vessel. Now class, since hydrostatic pressure is very high, it allows for the movement of water. Okay, so let's say, for instance, class, there is water inside your capillary or your arterial end. Because the hydrostatic pressure is so high, it will force the water out of the capillary and into our interstitial space. Okay, it will force it towards our interstitial space, wherein, class, our osmotic pressure is much higher than the one inside our arterial end of the blood vessel, much higher than in our arterial end of the blood pressure and the blood vessel. So it will pull the water into it, and because there is also high hydrostatic pressure, it will also push the water out of the blood vessel. Now class, that is not similar in our venous end. Diba? This is the arterial end, this is the venous end. In our venous end class, the hydrostatic pressure is low. Because the hydrostatic pressure is low, osmotic pressure is much higher. Osmotic pressure is much higher. So the tendency is class that once the water goes inside your interstitial space, it will then move towards the outside of the venous end, wherein it will now enter, because the osmotic pressure in this end is much higher. And if you remember class, osmotic pressure is the one that pulls fluids towards its source. Okay, since the osmotic pressure here is much higher and the hydrostatic pressure here is much lower, the water can now safely enter your venous end, the venous end. Okay. Now class, this is under normal circumstances. This is under normal circumstances, diba? Water will exit and then enter back up due to the changes in pressure. But if you've noticed class, they are equal. Okay, it is normal because it is equal. There is no since this one is increased, nga result siya decreased. Since this one is decreased, nga result siya is increased. There is an equilibrium between both sides. Now class, in situations wherein it is not normal, let's say for example class, during an infection. Okay, this is your venous end and this is your arterial end. Okay, now class, if you remember class, during an infection, the permeability of your blood vessels are increased. Okay, because this is a site of injury and blood needs to go to the site of injury. Okay, now during an infection, this is what happens. Okay, the hydrostatic pressure here will also increase. Okay, but the osmotic pressure here will decrease substantially. Okay, substantially. When I say substantially, it's because of this. Okay, remember, okay, during your infectious process, your albumin class will go to your site of injury. So instead of having your albumin inside your blood vessels class, your albumin will now go into your interstitial space. Okay, interstitial space. In turn class, because there is albumin, this will have increased osmotic pressure. Now class, water, as like before, it will enter your interstitial space. Now here is the difference. Since most of the albumin is already found in your interstitial space, since most of the albumin is found in your interstitial space, class, when water moves towards your venous end class, there will be very little albumin in your venous end because it has already exited, it entered the site of injury near the interstitial space. Now class, since there is no more albumin class, the hydrostatic pressure here, which was already decreased, okay, but the osmotic pressure here will also decrease. Diba? Kaya wala naman siya proteins. There are no albumin anymore. And if you remember class, albumin is the one that maintains osmotic pressure. So the tendency there class is that since the osmotic pressure or the pooling pressure is much higher in the interstitial space than in your venous side, okay, since it is much higher, okay, the tendency there is that the water will not move. It will not move towards your venous side. Instead, class, the water will stay in your interstitial space. And if you remember class, water accumulation in your interstitial space will cause what we call edema. It will cause what we call edema or swelling. See? Is if you've noticed class, as contrasted from the normal, no, there is actually now an imbalance. Okay? There is an imbalance now, di ba? Normally class, the osmotic pressure on the venous side should be increased because na naman dire ang albumin, di ba? Supposedly the albumin should be here. But in this instance class, no, during an infectious process wherein the blood vessels are more permeable, the albumin will exit the blood vessel. Albumin, kini mga dots, will exit the blood vessel and they will stay in the interstitial space. Because if you remember class, the proteins, the albumin, okay, the albumin such as the proteins such as albumin do not only function to maintain osmotic pressure, but they are also the building blocks, okay? The building blocks for regeneration, okay? And that is it. That is the first part of your fluids and electrolytes.